Assalamualaikum and greetings to everyone. My name is Noor Farahin and today I will deliver a speech titled Social Media Fuels the Dangerous Trend of Self-Diagnosing Mental Health Issues. Before that, let me begin with this eye-opening thought. Imagine scrolling through TikTok and seeing a content creator list symptoms like zoning out, overthinking, or feeling tired all the time. The creator confidently claims you probably have ADHD or depression. Without a second thought, thousands of viewers begin to question their own mental health, fully convinced they have found the answer to their struggles. This is the dangerous reality we live in today, where social media is treated like a doctor and every user becomes a self-diagnosed patient. As a student who uses social media daily, you are often exposed to mental health content that seems like relatable. But in reality, depending on it for diagnosis can cause confusions, anxiety, and make real issues harder to recognize. That's why it's really important to understand the risk and know when to seek proper help. As someone who has personally witnessed the effects of self-diagnosis among friends and peers, I became deeply interested in how social media contribute to this issue. I have read insights from psychologists and studies on how online platforms influence mental health. Through this speech, I will share what I have learned and why seeking proper support is really important. Before I begin, it's really important to understand that self-diagnosing mental health issues through social media is a dangerous trend. It leads to misinformation, delays in treatment, and reinforces harmful stereotypes. So in my speech, I will lay down three main points. First, how social media platforms contribute to the growing trend of self-diagnosis. Second, I will discuss the dangers of relying on unverified content for mental health. And finally, I will offer suggestions on how we can prevent the harmful effects of self-diagnosis. So first, how short mental health videos have led many young people to casually self-diagnose based on unverified information. One major reason why users turn to platforms like TikTok and Instagram for mental health guidance is the lack of access to the professional help and a need for emotional validation. According to a 2024 study by Selinkosar, many users feel ashamed to speak openly about their struggles, and social media becomes a safer space to express themselves without fear of judgment. The same study also found that mental health content help people feel understood and less alone, leading them to self-diagnose when professional help is unavailable or unaffordable. This shows that social media beyond entertainment fills a serious emotional gap. By posting symptoms online to seek advice from strangers like this we often see on TikTok, it is not the right way to deal with mental health problems. Next, while social media fills an emotional gap for many people, it also brings unintended consequences, especially when people rely it on for mental health guidance. Although social media may offer comfort, it often spreads misinformation that leads to harmful self-diagnosis and worsen mental health. According to Hassan 2023, self-diagnosis may give short-term relief but usually leads to overthinking and stress, not clarity. The study also found that post-normalizing conditions like anxiety increase the chances of self-diagnosing, especially when viewers admire the influencer when they share the content. This actually goes against the health model belief, which suggests people to take better action when they get accurate, supportive information and not vague or misleading advice. Starvey and Bell 2013 also found that relying on unverified content can lead to increased anxiety, health-related worry, and avoidance behavior, all of which worsen mental health. For example, many users take depression tests on TikTok and post their result, influencing others to do the same. But sometimes, it's just normal stress. Misreading it as a disorder based on social media can do more harm than good. Thus, to prevent harmful effects, we have just seen it's really important for parents and schools to take a more active role in preventing harmful self-diagnosis on social media. To support, a study by Noor et al. 2024 emphasized that parents should not be judgmental or make comparison when children express emotional struggles that only worsen the child's condition. Instead, parents should encourage their children to consult psychologists or psychiatrists when signs of mental health problems start to appear, rather than leaving them rely on social media. Additionally, schools can help by implementing mental health programs that involve parents and raise awareness. This can reduce the urge to self-diagnose and promote responsible mental health care. In closing, it's really important to take mental health seriously. It may seem like mental health issues are easy to understand through social media, but self-diagnosing through unverified content can lead to more harm than good. We have seen how social media encourages self-diagnosis, how that leads to confusion and anxiety, and how parents and schools must take action to prevent it from becoming worsened. So what can we do about it? If you are a parent, talk to your children, listen without judging, and guide them to professional help. If you are an educator, advocate for mental health programs that involve students and families. And if you are a young person struggling, please know it's really okay to ask for help, but that help should come from a medical expert, not a social media video. To end my speech today, I want to say this. Mental health is not a trend to follow, it's a truth to understand. Believing in 50-second videos won't heal your mind. In fact, it can make things worse if you keep absorbing random advice from strangers online. That's all for my speech today. Thank you for listening.